by police departments to address this issue from a ground roots level, and we certainly stand with the senators in requiring, if law enforcement is able to change the way they think about addiction, requiring the FDA to do the same and to hold those accountable who need to be held accountable at a federal level. Thank you.
Let me say it's my pleasure to introduce a friend of mine I've known for a long time. He's dedicated his life to law enforcement. He's a former sheriff of Boone County. The southern coalfields of West Virginia has been hit extremely hard. He's now executive director of the Sheriff's Association of the state of West Virginia, Rodney Miller.
Good afternoon, and thank you, Senators, for having us up here. In the law enforcement community, what normally takes place when a situation gets bad, when it gets bad on the street, cops call for backup. In this situation, our distinguished senators have called for backup, and we're very, very proud to stand with you on this very important topic. Now, as law enforcement officers, we are now calling for backup from the FDA. We have to have, at the highest level, the policing to combat the opioid drug abuse in the United States. It's kind of a jargon term that we've termed in southern West Virginia, but it's almost the numbing of America with what's taking place with the prescriptions of opioids. We have a population that have literally broken their backs for the energy of the United States and the mining industry, that when they need help from physicians, they get it in the form of opiates, reportedly for a short-term solution, which comes into a long-term solution. That ends up being a gateway drug into the heroin epidemic that we're seeing across the United States. And we don't use the word epidemic lightly. Drug overdoses have become the leading cause of injury and death, surpassing motor vehicle-related deaths, not just in West Virginia, but across the country. In 2011, drug misuse and abuse caused about 2.5 million emergency room visits to local hospitals. Of these, more than 1.4 million of those were related to pharmaceuticals. Everyone in our community, or especially our law enforcement officers who are on the front lines of this epidemic, every day are trying to be aggressive as possible in eliminating the epidemic. In West Virginia, for example, we're one of the first states that jumped on board with a needle syringe exchange program. We've got to do something. And from a personal standpoint, I was probably one of the worst in 30 plus years of law enforcement to say that we have to arrest and incarcerate everyone that we can potentially get our hands on when it comes to the drug problem. After 30 years plus looking at the problem, that's simply not working. We've got to reach and come with more innovative ideas, but that alone won't work. We have to have help from the top. Just because an individual calls 911 does not mean that they have to be in fear for being incarcerated or arrested. I think the Chief's program, and we found out more about that earlier, is great. If an individual comes in and turns themselves in, brings their drugs, they want help, they actively want help, that's what we in law enforcement are supposed to do. We're supposed to help people. It's not all about what you see on television, locking the people up in the visits to the courtroom. We're truly public servants that are out to try to help our society. From a personal standpoint, I've seen what impacts it has had to the families, especially in southern West Virginia, in Boone County where I'm from. They are asking for help. They are asking for help from the highest level. It's important enough that they're asking for help that I make the 7-hour drive up here to stand by our senators to let you know, let the FDA know, this is not a joke. This is serious. We are now asking for their backup along the ways. Recently, a West Virginia television station put out a report on the national average of babies being born as drug dependent. Babies born drug dependent, a national average is about 5 per 1,000. In West Virginia, it's 5 times that amount. Approximately 37 out of 1,000 are born drug dependent. The average cost for delivering a baby is around $13,000 for a non-addicted baby. If you turn that around for a drug-dependent baby, that translates to about $84,000. We simply can't afford to continue going the way we are going, socially, economically, and emotionally. It's an emotional topic in West Virginia, there are people that want help. They don't know where to turn. They have to have facilities. They have to have resources to go to. We hear from physicians, we don't know what to do. We prescribe for what we have given information for. We're hearing that they're asking for help. We're hearing that treatment centers are needed. We're hearing from pharmacists, we can't not fill these prescriptions because the doctors write them. We have to fulfill their orders. So there's much more that we could go on, and we could stand here for all day and go on with this, but we in the law enforcement community certainly would like to thank Senator Manchin and Senator Markey for fighting the change in the FDA that's going to help stop these addictive drugs, because we have to do something, and we're calling for backup because it is that serious a problem on our streets. Thank you.
So as you've been hearing, this is largely a pharmaceutical company and physician-created crisis in our country. And the law enforcement community, the treatment community, is asking for help. The experts are those who are in law enforcement. The experts are those who are in the treatment community. And just to keep this in the back of your mind, just pick a number. How much opioid pain-killing prescription drugs were authorized by the DEA last year? Just pick a number in your mind with regard to how many pills could be made out of that, what they approved last year. Pick a number. How many pills for America? Here's the answer. 12 billion pills for our country last year. It's just staggering. And what we do is we see the consequences on the streets of our country. We have here a man, John Rosenthal, who is co-founder of the Police-Assisted Addiction and Recovery Initiative. He's been working very closely with Chief Campanello to perfect it in Massachusetts and then spread it across the country, because it is a very smart way of dealing with this issue. John, please come over.
Thank you so much, Senators, for taking the leadership on this public health epidemic. And we're a country of people and laws. And sadly, when it comes to the pharmaceutical industry, we have an FDA that is truly more of a lapdog than a watchdog. And it's resulting in over 40,000 deaths a year. You know, when I was asked to come speak last week, little did I know that I'd be leaving Washington and going to my nephew's funeral from an opioid overdose. Look, folks, you know, there's only two solutions here. You can talk about root causes, you can talk about, you know, the nominee, and I've been a huge supporter of the president, but it's shameful and it's irresponsible to have an FDA director who virtually is more concerned about the pharmaceutical industry than public health and safety. There are two options, folks. It's treatment or death. And I bet if I asked for a show of hands in this room of what family hasn't been impacted by the opioid addiction epidemic, we wouldn't see any hands. So what we've attempted to do is fill the void that, frankly, the FDA has left behind. And so with law enforcement as the lead, and people aren't used to saying no to police chiefs, we created this innovative program in Gloucester, Mass. It simply said to the folks suffering with the disease of addiction that this is a chronic disease, no different than diabetes, no different from cancer. It needs to be treated the same way. We need to get rid of the barriers that consider people who are addicted junkies and get people into treatment, not jail. And so when the police chief announces that beginning June 1st, anyone with the disease of addiction can come into the Gloucester Police Department with or without their drugs and get into treatment, not jail, we had over 400 people come into the Gloucester Police Department in the last 8 months. and another 400 among the 65 police departments across the country that have partnered, from Maine, the very state where the governor is saying he may call out the National Guard to arrest addicts. We have police chiefs in Scarborough and Augusta and Paris actually helping them into treatment. And there's another 100 police departments across the country who are embracing this, and over 200 treatment centers. Don't ever accept that there are no treatment beds. There are treatment beds. Sadly, there are treatment beds when a police chief calls. Okay, well, then that's the reality. But we need treatment beds, and we need a continuum of care for this disease, like any other disease, across this country. And Congress needs to make that happen. And the last thing we need is an FDA director who literally is a lapdog for the pharmaceutical industry versus a watchdog for the American people. So we have a great solution in Gloucester, and it's taking off across the country. We're changing the conversation. We're changing the continuum of care for this disease. But we can't rely on law enforcement to do it. We need Congress to act, and act quickly, to deal with this epidemic. And I cannot thank our Senators Markey and Manchin enough for being courageous, taking a leadership role, and doing whatever is necessary to hold up this appointment, to get the President and the majority of Congress to understand that we need to address this disease of the epidemic of addiction. And it is not appropriate for a member of the pharmaceutical industry, a benefactor of the pharmaceutical industry, to be a watchdog for that very industry. Thank you.
I couldn't put it any better than John just put it, because we're asking the President to get involved, to step up. I believe the President truly understands it. He understands what an epidemic we have. And to illustrate that I believe that the President gets it, he came to the state of West Virginia, one of the hardest states hit, and one of his least supportive states. That's where his ratings are probably the poorest in the nation. So for him to come to West Virginia and take this head on says that he gets it. I believe that this nomination is staff-driven, not presidential-driven. And I believe that the President should step in and say, wait a minute, maybe we better rethink this. That's what we're hoping for. Just trying to say, Mr. President, we need you to give us an advocate. Give us people with expertise. Person that basically has not only the ability, has the expertise, the clinical research ability, but also the passion to change, the culture of the FDA. That's all we're asking for. You're hearing from these experts, and Ed and I are so pleased with our states are represented so well. And our final, we saved our best for last, as always. We say that the females are always the best for last. Rhonda Eddy. Rhonda has been doing yeoman's job for many, many, many years. She's the director of the Jefferson Day Report Center in Eastern Panhandle of West Virginia. It's been hit extremely hard because of close proximity to Washington, and Baltimore, as you know, has been truly a center for this epidemic. So with that, I'll give you Rhonda Eddy, who really knows it well. Rhonda.
Thank you, Senators. My home county of Jefferson County is at the epicenter of the drug problem in West Virginia. It has the 5th highest overdose rate in the state. Drug abuse, like we've heard, is a chronic disease, and we need to start treating it as one. We need to continue to do what we can to help those suffering from the disease of addiction through evidence-based programs, services, and activities to reduce recidivism and create a choice in incarceration. It's so important that our facility, along with law enforcement officers and drug task forces, have the resources to combat the influx of drugs coming into our county. Last month, Jefferson County was one of 14 newly designated counties nationwide that will receive HIDA funding. We're very pleased Senator Manchin worked with Director Botticelli and the leaders at ONDCP to ensure that Jefferson County and other high-risk communities in West Virginia get the help they need. This important designation will ensure that HIDA resources will be available for those who are on the front lines of the fight in Jefferson County. We believe that more needs to be done to properly address this crisis. We support the efforts of Senator Manchin and Markey to change the culture in the FDA so that we can stop these addictive prescription drugs from harming our communities. The health and safety of our families and communities in West Virginia and in Jefferson County depends on ending this drug epidemic.
Thank you.
Thank you.
Anybody have any
Questions?
Yeah.
So Senators, would you then be planning to talk for the full 30 hours for the permitted? And I guess also, if assuming that Dr. Califf does get the 51 votes required, what are your next?
You're talking about the 60 votes today that's required to move on?
Yes, 60 votes today
And 51 votes tomorrow for confirmation. We're going to do everything humanly possible. We have a lot of senators, hopefully, that we can engage. As you all know, he came out with a voice vote out of a unanimous voice vote out of the Health Committee. I don't think enough of that was basically, or let this information we're giving, or for whatever reason, nobody on the committee has the passion that we have, or maybe their state's been affected like ours. But with that being said, we've been reaching out, Ed and I both been reaching out to our colleagues, and we're hopefully that they will engage and understand. And you know, if we're unsuccessful in that change and he gets, well, we're hoping that we've raised this to a level high enough that the next administration is going to understand that there has to be a fight and a change to the top, and culture must change within that industry.
No, I agree with Joe. We're gonna do everything
Give
that
it all we
can.
got.
We're gonna give it everything we've got. We just think that all issues go through 3 phases: political education, political activation, political implementation. There's just too much ignorance on this issue. It's, to a very large extent, the #1 issue on the streets of America right now. When you're looking at a doubling, and then a doubling again, and then a doubling again of those who are dying from this issue, this is the terrorist call that people are afraid
on
of getting.
top- on top-
That another member of their family has fallen victim to this opioid crisis. When it's greater than all car deaths, when it's greater than all gun deaths in the country, when you
All
could barely
accidents.
measure it just 20 years ago, this is very real for people, and we feel that we have an obligation to ensure that everyone hears this issue, regardless of what the final vote is on Dr. Califf.
Let me just say this on what Ed said. If you has this spread of epidemic and people that are affected all over the country, and it continues to multiply and multiply, would you not think the person in charge, the agency in charge of the drugs that are causing this, that they would say, oh, let's stop and take a look at this, something's wrong, but yet they double down and we have more drugs being approved to come on the market than ever in the history of our country? Don't you think that basically before we continue to try to appease a business plan, we should think about the public plan, keeping them alive? That's all we're asking for. I know you have your hand.
Oh, hi, thank you, Donna Young with Script. I had a question on the fee that you had proposed. The fee on
We're working on that. Let me just tell you how we've come about that. It's every time I go and we talk to all of them, we need help. And you know what? They'll tell you, we don't have enough treatment centers. People are begging for help, and it's exhausting all of your resources, what you have. It's taxing every one of our local governments to what they can do because there's so much need. And I'm just thinking, I have a piece of legislation. I'm sure that Ed's going to be right there with me. He always has been on this. And we're going to look at this and say, okay, we're trying to put it so it really doesn't affect the person that's in need. The person should be getting the treatments they need, that the pills would not be too expensive. But on a milligram of opiate, there should be some type of a fee that says this will be only dedicated and used for treatment centers. That's all. Now, I know, like, oh, the new tax, new this, new that. My goodness, you know, you're hauling about everything else. We've got to find ways to save people's life. And unless you want to keep building prisons, unless you want all of your states and all of your communities, you're paying jail cell fees now. We pay jail fees. The highest fee that most all state and all county governments has is paying for incarceration because of drugs. So I'm saying, why shouldn't the person causing it pay something? Yes.
So is that a tax on the pharma industry or on the people who are actually?
Oh, they'll try to pass it on and say that, but basically it's going to come with the production, the manufacture, farmers' manufacture of these opiates. We know they're addictive, you know, and the bottom line is we'd like to make you think before you keep passing them out like candy.
Yeah, you talked a little bit about trying to garner support. Can you say how many senators you got from either side that has been willing to join you now?
We're building, and again, it's not just towards this one moment. It's towards this whole year. What is going to happen? We're deep into this crisis. And as I said, whether we win or lose, this is going to be a struggle that actually is going to go into the appropriations process, into the authorization process for bills that are going to be coming down the line. So Joe and I are saying, we're starting it right here. We're starting it right here, saying that the FDA has played a huge role in creating this epidemic, and that every member of the Senate and every member of the House should understand it, and that we're then going to take steps subsequent to that. So the total number of votes, right now we don't have a count, but I will tell you this, and this is how Joe and I feel, that we're now approaching losing a Vietnam's war worth of people every single year in our country. And the least that we want to be able to say is that we tried. We really tried to bring this to the attention of the Senate and the American people so that we started to take the actions necessary to reverse it.
Let me just say this. There's not a senator that I've spoken to or Ed has spoken to that's not sympathetic and understands the cause that we're on. If there's only two of us, if it's just Ed and I, it's a fight worth taking on to bring it to this level. There wasn't that much discussion on Dr. Califf. We've said this very loud. This is a good man. This is not a person with some kind of resume that there should be a deal breaker on. Not at all. But just finally, should we not change a direction? And how do you change a direction when a person basically comes from an industry that's supported through clinical research? It's hard. Human nature doesn't let you make the changes to say, you've been my friend and you've supported me for 20 years. Guess what? No more. We got enough. That's all we're saying. That's all we're saying. We're not saying anything against this gentleman's character. And with that being said, a lot of our senators have probably already agreed, and they've had phone calls made to them. We just want them to think long and hard that we've got to start changing, and the change starts now.
Excellent. Sheila Kaplan with staff. Can you tell me, you've expressed your disappointment about how FDA has been lax and let this epidemic build. Why do you think they haven't?
I think their mission statement, we're going to try to change their mission statement. We have a piece of legislation, and I think we'll have a tremendous amount of support, bipartisan, that the mission statement should be the well-being and the public health. That's not their mission statement, Doctor, and I think you heard Dr. Clodney speak about that. They don't think that they've done anything. They said, we did our job, they basically admit this and this. And he said, if you look at historically where they're coming from, once they got hit hard on Zohydro, and once we start looking into Zohydro, how it came to market, unneeded, and they gave me the excuse because of liver damage and this and that, which a bunch of baloney as far as what we could see. They just were determined to bring this to market, and they added insult to injury after we forced them to take all opiates from a Schedule 3 to Schedule 2. That's when they said, okay, let's just double down now, and they went against their 11-2 against the recommendation. From that day forward, they says, we're not going to take this type of scrutiny anymore. We're going to basically just bypass it. And it's just callousness of what they're doing, absolutely callous. And I don't think the president knows. I really don't. If we do nothing more, I hope that we basically have said, Mr. President, help us. Give us somebody that'll fight, because we think he has fight left in him.
Can I say this? The original sin was 20 years ago.
Yeah.
Purdue Pharma represented to the FDA that OxyContin was abuse deterrent.
Right.
Well, OxyContin is oxycodone. As I said, it is nearly identical to heroin. OxyContin is shot for the phrase oxycodone continuously going into the blood system of the patient. That's what it means, OxyContin. Ultimately, it turned out that the FDA swallowed that representation, hook, line, and sinker, and it was completely and totally false. Ultimately, Purdue had to pay huge fines for that misrepresentation. But that was the beginning. It's only 20 years old. And the culture at the FDA has continued as business as usual from that moment on. And what Joe and I are saying, what all of these people are saying, what people on the streets of the country are saying, is that enough is enough. This whole culture has to change. And that's what Joe and I are trying to do on the Senate floor. It's to raise this issue so that the whole idea of abuse deterrent in OxyContin is put to rest once and for all. Yes, maybe it's more difficult to crush, but if you're taking these pills orally, the ones that are on the market right now, you're going to become an addict if you don't have the proper understanding of how limited its use can be. And that will ultimately lead to the heroin overdose. Again, 80% of all people overdosing from heroin in the United States today started on these prescription drugs. And we don't think that it's fully understood, and the FDA is not responding to this cause.
Yeah.
Yes.
If the FDA, sorry, I'm Shannon, I'm with MedPage today. If the FDA were to make changes, if they were to make some concessions and allow advisory committee meetings before every opioid drug could be approved, would you?
Well, we have, that's the legislation we have now. I have legislation basically that says that basically if their advisory committee, everything must go before an advisory committee. You cannot bring an opiate to market unless it goes before an advisory committee. If the advisory committee recommends against approval, you cannot bring it to market unless you come to Congress. Explain to us why you want to put this new product on the market for our citizens all over this great country, and tell me why it's needed. Tell me what we're lacking right now. We're the most addicted nation on earth. We're 5% of the population of the world, and we consume 80% of the opiates of the world. When you think back to 1980 and before, for the first 200 years of this great country, you didn't have these dirt drugs, these legal drugs. You always heard of some things on the market when you were in college and kids, but you never had legal drugs back there that would do what these are doing. And all of a sudden, Purdue Pharma comes on, has the new wonder drugs going to cure all and take care of all the problems, and it doubled down and created all the problems. They're the same ones now saying, go ahead and give it to 11-year-olds. We'll explain to them, only in certain cases. Well, you said you're going to do the same thing with OxyContin, and look what happened there. Just go back and look at how much money they spent advertising, promoting, and look at the absolute amount of pills put on the market after that. So we're not here defending a business plan, and I'm not going to allow and stand as a U.S. Senator and allow a business plan to destroy the lives of West Virginians or Americans. And
Can I
that's what we're doing.
just answer your question specifically? The FDA approved Oxy for kids without an advisory panel. They approved Hyzinga without an advisory panel. They approved Tajinique without an advisory panel. When Dr. Califf came in to visit me in my office in November, I asked him point blank, would you have advisory committees for all future opioid approval? He did not give me an answer. I asked Sylvia Burwell, the Secretary of Health and Human Services, the same question. They said they needed time to deliberate. That was in December. Then they announced just 2 weeks ago that they would not have advisory panels for the new opioids, which were in the pipeline at the FDA. So we've already received our answer as to whether or not the FDA is going to change its mind on whether or not there are advisory panels of experts like Dr. Kolodny who can raise the tough issues with the FDA and with the companies on the impact that these drugs have upon the American people. Question? Yes, sir.
I want to Senator Manchin ask.
Okay, good.
Yeah.
I'm sorry.
So I want to ask you a Supreme Court question. You've expressed your preference, openness to have the president
Sure.
nominate someone and go through the confirmation proceedings. On the other side, a lot of Democrats are saying that if there aren't confirmation hearings, that we should tie up the Senate floor, engage in those tactics. Would you be concerned?
I've been here for 5 years and we've been tied up. I don't want to be tied up no more. They know how I feel. You know what I've said? No vote, and people take the safe path. Oh, these are tough votes. Don't take them. I can assure you, a no vote is worse, is much worse than a tough vote. And with that being said, let the president do his job. He's given us Califf. Asked Mitch McConnell why all of a sudden Califf came to the floor and we're voting. And if you're thinking the Democrats, here we are. If we don't represent all sides and everything in between the Democratic Party, I don't know who does. So with Ed and I standing here, we are opposing that respectfully. You can do that respectfully. And we're asking the president to engage and give us somebody. Give us somebody that has the advice, has the basically expertise, that's going to be an advocate for the people of America and keep these darn drugs off, these killer drugs. So I do recommend allow the president, he's going to make the nomination. We should accept that nomination. We should debate that nomination. And you know what? If we find that person to be unacceptable, like we find Califf, we'll be up here speaking against that person too.
Would you be concerned, you obviously differ from the president on the issue of abortion specifically. Are you concerned that his nominee could tilt the court to the left further on?
I think, there's going to be some even-keeled people. I think that basically, I truly would believe that he would pick somebody that's a centrist and basically follows the Constitution. Okay? Now, you can look at that person's rulings in the back, I think, expertise. Don't give me a newbie. Give me somebody that's got, has judicial experience, and let us make a decision from there. But yes, we look at all those things. I'm not a one-issue person, as you know. I'm going to look at the whole gambit of a person who can make a good decision that keeps the country strong and follows the Constitution.
Yep. The Constitution says that the president shall nominate
Let's give him
a new candidate for the Supreme Court. There is no asterisk in the Constitution that says, except in the last year of a Democratic president, and that the Supreme Court should stay 4-4 for more than 1 year. Okay, so this is a huge issue. That's a huge issue that ultimately is going to cause a lot of political friction on the floor of the Senate, but in our country as well as in the presidential election. Yes, sir.
You mentioned working on this during the appropriations process. Would the two of you support measures to withhold funding from FDA over this topic?
If they're unwilling to accept the mission statement of changing their mission towards putting the public first, absolutely. We have to use if we don't believe that the Food and Drug Administration is responsible for the public well-being, and they're going to ignore that and say that's not part of our mission, and we as a Congress vote on that, and they want to fight us, yeah.
Tom Burton with the Wall Street Journal. Senator Manchin mentioned the companion issue of Dr. Califf's financial relationships with industry. And I'm wondering if either of you have found that issue has resonated at all with any of your colleagues.
No, I haven't found to where it's to a level where there's a concern that he has done anything wrong. He has not. He even donated some of the money back. I knew all that. Went through everything with him from that standpoint. But when you're in a culture that basically your program, your clinical research programs, depends upon the funding that comes from pharma. When you look at a lot of the pharma companies that basically produce the opiates that he has to review, and now he's at the head, basically, and how this has been coming on fast tracking, I don't believe that we're going to see a slowdown of that whatsoever, or a repositioning of that. And with his relationship and association, it's just human nature. It'd be tough. That's all we're saying.
Yes, sir.
2 weeks ago, the Judiciary Committee advanced legislation that would address the opioid epidemic. Are you expecting that to come to the floor soon? And will you and your Democratic colleagues support it if it doesn't include the emergency supplemental funding?
I think the Republican leadership is planning on meeting today and tomorrow to decide what the floor schedule for this week is going to be, so we don't know the answer to that at this point in time. Obviously, we want to ensure that there is more funding. The president has called for $1.1 billion more dollars in treatment funding. These local communities are loaded with heroes, but heroes need help. It costs money to provide these beds, to provide the treatment, to provide the education. So we're going to continue to raise that issue. Senator Shaheen is the leader on that, and we're going to continue to elevate it because the funding should be there. Yes, sir.
You mentioned an amendment about prescriber education. Is that going to be on the Judiciary Committee bills?
Senator Blumenthal was making the amendment in the Judiciary Committee. He had an amendment that I had drafted with him, and they asked him to withhold that amendment before they completed the bill in the Judiciary Committee, but with a promise that we could raise that issue on the Senate floor. So that is our full intention, and Senator Manchin and I and others are all planning on working together to advance that goal. The amendment was there, and they just asked them to withhold.
We have quite a few changing the, basically changing the culture of the FDA. Should be a no-brainer, you would think. The Accountability for Public Safety Act should be also one as well, and Prescription Drug Abuse Prevention and Treatment Act. All of those we're going to find out, but they've been very encouraging to accept and work with these amendments, so we hope they will.
On the changing culture of FDA Act, do you think that legislation is needed before FDA can begin to weigh things like third-party risk or public health in opioid approvals? Or do you think that power already exists within FDA?
I would have thought common sense would have told you that power already existed, but we found that common sense is not real common in a lot of agencies, and we found out them to exercise less common sense than most agencies.
Thank you all so much.
Yeah.
An hour and,
On
an
that
hour
one,
and
on that one,
10
we
minutes
better quit on that
on
one.
an issue just tells you how important this is in terms
Thank
of the
you all.
interest
Appreciate
that
it
the
very much.
American people have in it. Thank you all so much. Thank you. Hi. Thank you. Just wait one second.
Is this a question, Senator?
Just,
I could name a few folks.
Chief.
We gotta catch a flight.
I gave it to,
It's nice meeting you. Good luck with your program.
Yep. Safe travel. I have.
Nice job.
You are